Good afternoon. Welcome, everyone. It's nice to see everyone today. We'll just give a few minutes for people to join before we get started. If you want, while we're waiting, if you want to type your name in the chat and any organization that you're affiliated with, you can put that as well. And go ahead and welcome your colleagues here in the room. And we'll give it like 2 more minutes to let everybody arrive and get settled. If you're just entering the room, feel free to enter your name and any organizational affiliation in the chat. And take a look at who's here in the room with you. Hey everyone, welcome. Okay, I'm going to do a quick scan and see if we have. Welcome everyone. We'll get started in just a few moments. We're just letting people arrive. And if you're just entering, please go ahead and greet your colleagues in the chat. You can write your name and any organizational affiliation if you have one, and kind of take a look at who else is in the room with us today. All right. All right, why don't we go ahead and get started? I did not see Sarah enter the room, so I just want to see if Sarah is here to kick us off.
Still joining, so
she's joining right now.
She's joining right now. Okay. Still people coming in. All right. And you can continue to enter your name and organizational affiliation in the chat while we get started here. And Leapy, maybe you want, oh, there's Sarah. Hi, Sarah, welcome. All right. Sarah, I will turn it over to you to kind of open us up, and then we'll get started.
Great. Thanks so much. Hi, everyone. Good afternoon. I'm Sarah Mayen, and I use she, her pronoun. For those of you who I haven't met, I'm the inaugural director of the Department of Homeless Services and Housing, and I'm excited to be here with you today. Thanks for joining us for our second town hall. The purpose of these town halls is to maintain ongoing dialogue as we move urgently to carry out the Board of Supervisors' vision to bring the county's homeless response under one unified department to ensure accountability and faster results of county resources around homelessness. So we have a full agenda today. First, our colleagues at Changewell will provide a report back on what we covered on our first town hall in July. And what we heard from all of you regarding our guiding principles and the organizational structure for the new department. Next, my colleagues Lipi Shimkata and Ruth Guerrero will lead a discussion about the contracting model that it's used at Housing for Health. We look forward to hearing your input on how we should scale this model to serve more people with a broader range of need under HSH. And then lastly, we're going to share some additional opportunities to engage in this work that are upcoming. So I'm going to turn it over to Changewell, who's partnering with the county to build better systems, to improve our coordination, and to move people into housing faster. Thanks so much.
Great. Thanks, Sarah. Welcome, everyone. I know there's just some folks still entering, so welcome to the second town hall. I'm Elena Fiallo, one of the co-managing directors of Changewell Project. And I am going to talk us through the feedback from the last town hall, as Sarah mentioned. But first, let's start with our community agreements. What I'm looking for at the end here is just a thumbs up. You can use the emojis, you can raise your hand just to let me know that you agree that we're going to respect confidentiality, that we'll be present and engaged, that we respect the wisdom in the group, that once we get into breakout rooms, one person speaks at a time, take space and make space. Most of all, be patient with technology and mindful of participants joining. Expect and accept non-closure, respect one another, and recognize that conflict may arise, just respond respectfully. So and please feel free to add anything in the chat that's not there that you would like to see, and we can add it in for next time. But if you want to just give me, I see thumbs up. If you want to give me thumbs up, that would be great. And then we can move forward. All right, so I'm going to do a brief report back on what we discussed last time. We had some great feedback. We had a really great time in breakout groups. We also issued surveys, and we had some really great feedback from you all, and we really appreciate it. There's really some great information that came back. So we can go to the next slide. Thank you. Okay, so the first thing we looked at was some draft guiding principles, and we asked people to rank their sort of top guiding principles. And we recognize that all of them are important, but we asked people to kind of rank them. So these were the guiding principles that we looked at: a system that's effective and easy for people to navigate, programs that deliver impact and reduce administrative burdens on providers, greater accountability to ensure investments lead to results, a more equitable system that reduces racial and ethnic disparities in homelessness, and consistent opportunities for open communication. So let's go to the next slide and we'll look at how they were ranked. Now we'll drop a link in the chat that is a link to this dashboard. This is a little bit hard to see, but I just want to alert you to the fact that you can see it a little bit better with the link. So let's talk through. So a system that's effective and easy for people to navigate, 171 or 79% of the people that attended the last town hall rank this in their top 3. Programs that deliver impact and reduce administrative burdens, 142 people or 66% ranked this in their top 3. And then finally, greater accountability to ensure investments leads to results, was 138 or 64% of you ranked this in your top 3. I'll go through the rest of them as well. A more equitable system was ranked 119 or 55% of folks ranked this in their top 3. And the last one, consistent opportunities for open communication, 65, or 30% ranked this in their top 3. So this is how those results fell out. We can go to the next slide. So the next thing we did was take a look at this functional org chart that was released in February of this year. And we asked people a couple of questions. First question was, what's missing from this grouping of functions? And the second question was, how should the department really organize this work? So I want to look at the first question and the results from that on the next slide. So, what's missing from the org chart, people indicated that the chart lacked clear visibility of core services, including mental health, gender-based violence response, emergency housing, and reentry support. They also mentioned that we needed to have targeted attention for youth, LGBTQ+ folks, gender-based violence survivors, and immigrants, and that the absence of these really risked a one-size-fits-all service delivery. You also mentioned equity and representation, both in the survey and in the small breakout groups. People asked that equity be integrated across the structure and not siloed in one division or another, and that lived experience, lived expertise should be embedded across all operational areas. Clarity in communication was another big theme, the need to simplify language and clearly clarify how responsibilities are distributed within the org chart. And then accountability and oversight, concerns were raised about how the department will ensure follow through, how we're going to measure outcomes, and remain transparent to the public. Next slide, please. Okay, so about the question of how the department should organize its work, there was overwhelming support for anchoring the department in a regional model or a spa-based model to allow for geographic response and alignment within existing service ecosystems in various subregions. People also advocated almost equally for a structure that included subpopulation specific expertise, right? And I think in the end, we sort of got the sense from the feedback that we could kind of layer and combine these approaches to get the best of all worlds, where we're really delivering services in coordination locally and with specialized expertise. Community engagement, people want to have community engagement continue, that there's sustained community input, especially from folks with lived expertise and people currently experiencing homelessness, to ensure that the department remains responsive to their needs. Transparency and flexibility. Organizational design should be clear, adaptable, capable of evolving in response to community feedback and emerging needs. And then finally, systems coordination. While this wasn't emphasized as much in the surveys, but in our small breakout groups, folks highlighted the importance of integration across departments, especially with adjacent county partners or other service delivery partners to prevent service silos. So really great feedback. And I'm happy to reflect this back to you. This was amazing feedback in small breakout groups. We had over 500 people that participated in breakout groups. So great work, y'all. And the next slide, please. So I'm now going to hand it over to Lipi Shimkata, who is our main event for today, to talk us through the Shishma model. Thanks, Lipi.
Thank you, Elena. Thanks, everyone. So nice to see you all today to talk about contracting. We're going to try to make this as exciting as possible because contracting is exciting. So we're here to share with you what we've historically used, which is called the Supportive Housing and/or Services Master Agreement model. Most of you know it as the SHISHMA. Next slide, please. Housing for Health has used the SHISHMA model to provide straightforward and flexible approaches to contracting that has worked well for us. I really want to acknowledge Kathy Hanks, who's on this call, because really we wouldn't have been able to do this without her. And she has been sort of the mastermind behind all of how we've kept things really simple for all of you. So it takes a lot of us to be thinking about this, but she really set this up from the beginning for us. We have used this SHISHMA model to provide a really straightforward and flexible approach and not have as many contracting or amendments and things like that you might encounter in other types of contracting. We really try to pre-qualify nonprofits and community-based organizations to be on a list so that we can procure the list and have an ongoing list. So when we need to have new providers and new contractors, we're easily able to get people off of that list. We can quickly scale up. So you've known us for years, and there have been new programs and new funding sources. So we're able to really use this model and be able to get that money out the door as quickly as possible. And what we really like to do is streamline the administrative burden and also have a great deal of accountability. So you don't have to figure out which funding sources you need to bill. We'll do that on the back end so that you can get paid quickly. So we're hoping that this has been a model that's worked well for you. But today you get the opportunity to tell us what doesn't work, and we want to hear it all because this is the model we plan to take to the new department. Next slide, please. So how the master agreement works, this is really the secret sauce, right? You get a pool of qualified vendors who can provide these types of services. And many of you on this call are already on this master agreement. Some of you would like to get on the master agreement. So we're hoping after today, it's a little bit clearer, and you can also tell us, how to make things a little bit easier. There's a framework for the delivery of supportive services and housing services where it outlines roles, responsibilities, and expectations. You know that from us by the way we do program management, which we'll get into a little bit later. It also determines how funding can be allocated and managed across a work order. We call our contracts work orders, and it really gives you the flexibility to be able to deliver that service and be able to meet the needs of the folks that you're serving. We really don't want you to have to spend too much time on the administrative burden because you are the experts in the field doing the work. You should be out there, making sure that the service is getting provided and doing the great work you already do. We also set a minimum requirement. So we have some minimum requirements in all of our work orders and quality standards so that we can make sure that our funding is out there and you're able to provide the services effectively and meet the needs of the people that you are serving. And it also outlines compliance requirements. We have relevant laws and regulations as well as reporting mechanisms to monitor progress and outcomes. Next slide, please. So what really makes our SHSMA effective? We're going to get into it a little bit. Next slide, please. So this is a term that we know and really well here in the county, and it may not be something that you know as well in the public. So we're going to try to explain what this means. Delegated authority really allows the director, and right now the director of the Department of Health Services is able to accept funding from governmental, nonprofit, and private organizations. And we're able to add these funds very quickly to the work order, while we're also being able to increase the maximum obligation of funding up to by 100%. So this really means that if we're able to get funding from philanthropy or other governmental organizations, I'll just give an example. During COVID, we had the American Rescue Plan Act funding, which was a lot of funding to be able to come to communities very quickly, and we needed to demonstrate that we had to use it fast. And so we were able to accept that funding, and a lot of our contractors were able to do very quick work because we were able to put it into your contracts on the back end. It wasn't something that we asked you to have to track because that's something we track on our own to be able to report back, but you all have received this funding and you all did really great work with it and expended all of it. So these are ways that we're able to quickly get the funding into the contracts through delegated authority. Next slide, please. So this is how we do the flexible contracting by being able to rapidly scale services with minimal administrative burden on providers. It's an adaptable structure. Some work orders don't even have a maximum obligation amount. So if you're an ICMS provider, it actually is open-ended, so we can continue to scale you up as we need to. As we get funding in real time, we can shift those services and shift the amounts of funding you get and be able to continue to help grow that sector or that part of the work because of the funding that's been coming in. So we really do, again, try to be as flexible as possible. And again, if it's not as flexible as you wish, or there are things we could be fixing, today is the day to really let us know. Next slide, please. So the way we do contract management, Housing for Health assigns program managers in each program area. So you may have a contract in interim housing, street-based engagement, permanent housing, and we do have program managers that manage a portfolio of providers. So you may be very familiar with, when we say contact your Housing for Health program manager. You may have 3 different types of contracts or work orders with us, and you may have 3 different program managers, but they really do try to make sure that they're managing your portfolio for that particular service that you're providing for us. We really try to absorb the administrative complexity. So we are making sure that we're managing billing to other funders, so you don't. What you will do is you're going to submit one invoice to us for that one type of program area that you're contracted for, and we do all the braiding on the back end of all the other funding that comes in, so that, again, you are submitting one invoice to Housing for Health for that one program area, and we pay you out in just a few weeks. Program managers support providers by making sure that we can facilitate clinical service connections. We make sure we host case conferencing, we coordinate with the Medicaid managed care plans, and navigate referrals for enhanced care management, community supports, and in-home caregiving. So really try to provide a suite of services and integrated services that you may need. We also do work very closely with our other county partners, like the Department of Public Health with their Substance Abuse Prevention and Control Department. who are providing substance use services and try to be able to connect those services when your client may need it. Also with the Department of Mental Health, we work very closely with them and try to do integrated services with them as well. Our infrastructure includes centralized contracting and fiscal teams. So we can issue work orders, we monitor the deliverables, and we really do try to manage the performance data, lifting the administrative burden from the frontline providers. We also do a lot of technical assistance and training. Our program managers are technical assistance providers, but we also have a whole training department, which we hope that you are able to access and be able to attend those trainings. There's a lot of great information there. We actually have a whole brochure now. When we started out as a very small training team, we have a whole host of types of training that you can access anytime you want. Next slide, please. So I think I'm turning this over to Ruth now. So Ruth, this is you.
Yes, thank you. Thank you, Lipi. Also want to say thank you to Kathy Hanks. She was my mentor on this project. So good afternoon. My name is Ruth Guerrero. I use the pronouns he, she. I'm the manager here at Contracts and Grants, Department of Health Services. I'm going to go over the programs under HSH. I'll talk a little bit about kind of the process we go through. This slide provides an overview of the programs that will be funded under the new Department of the Homeless Services and Housing. So the first one is the street-based and engagement outreach, which provides for field-based or street outreach. The next one is our interim housing, stabilization housing, and recuperative care. Under this, it provides for low barrier, short-term supportive housing to individuals experiencing homelessness or unstable housing. And then the next one would be the permanent supportive housing, our PSH, provides for stable permanent housing. The flexible housing subsidy pool is our FHSP. And that pool includes collaborating with county agencies and participating funders, our in-home caregivers. This allows for services to clients in skilled facilities. We also have the legal services. It includes a variety of legal advocacy for clients, and then our capacity building services. It provides for various service trainings. So you'll see a lot of these different services that are provided under the SHSMA as you start looking at the different model, at the request, the RFSQ. So the SHSMA model is flexible and is designed to facilitate contracting for a diverse array of programs like the ones that I just mentioned above. Next slide, please. Okay. So the SHSMA was intentionally designed to create a more equitable process in contracting with the county. For large and small organizations to have the opportunity to scale up. It allows for HFH to encourage small and local providers to provide services, whether you're a small organization or whether you're experienced or new to the field, we're here to help and provide assistance, offer capacity building and technical assistance. Services are culturally responsive and community rooted. We encourage innovation and shared ownership. The intent behind the model is to improve service access for all Angelenos. Next slide, please. So to improve impact and reparability, the SHSMA model has set the foundation for what Housing for Health is today, and what this new department will become. It's a rapid response we did rapid response during COVID, integrated housing, health case management, and other support. This model encourages multiple accountabilities between service providers and the county. The Shishma has been decades of long experiment that has yielded incredible results. 94% retention and permanent supportive housing. So this has been across all permanent and supportive housing. Next slide, please. How to become a contractor. So I'll kind of go over the process for becoming a contractor. Some people already have this master agreement, the Shishma master agreement with us. However, if you're a new agency or you're interested in becoming a contractor, we have a link that we'll put on in the chat that will allow you to go directly into our solicitation process for Housing for Health. The application has been streamlined where agencies can go straight into the solicitation link. And then as you pull up that link, you'll see the documents, they're fillable documents, and you can, it'll give you all the information of where you need to submit it. So it's called the application is called Request for Applications, but you submit a statement of qualification. And that's the document that comes to the county, and then it is reviewed. Once it's approved, then you'll be issued a master agreement. Agencies may respond to other work order solicitations because with the master agreement, it doesn't provide for actual services. It's not, and Leafy mentioned it a little bit, that we work with work orders. So you'll have a master agreement that'll give you the ability to either do a work order solicitation to get work that'll be attached to your master agreement, or you'll get a direct award. So it just depends on the process that we utilize, but the first step is to start with a master agreement. Next slide, please. So if you want to learn more about the contracting process, this is the link. You can also ask questions and we'll respond to those questions through this link. And then, so I'll pass this on to Changewell. Thank you.
Thanks, Ruth and Leapy. We did want to take some time to answer questions. So Ruth and Sarah and Leapy are all here to answer questions. We did have a question in the chat. So please feel free to put questions in the chat, and or if you raise your hand, we'll call on you and you can ask your question directly to the team. So our first question is, how do you determine if you have a current master agreement? And if not, what's the link to apply to get on the Shishma, which Rachel posted the link to get on the Shishma. But Ruth or Leapy or Sarah, maybe just how would people know if they're on the master agreement, if they've applied in the past?
They can send me an email to this link here, to this email, this link that's on showing now, and they can just provide us with the name of their agency and we can do a search for that.
Okay, great, thank you. Does anyone have any questions? Feel free to raise your hand and you can come off mute to ask your question. They're all here, burning questions about the Shishma. Oh, okay, we have a question in the chat. Rick, the county just announced a likely $1 billion in cuts, mostly due to the safety net. Isn't that the topic of the day?
I guess I can take that. Yes, I mean, we're not in great financial times. We recognize that, but there are still places where we can still try to continue to do some work together. If we need to have a different space to be able to talk about cuts and things like that, I think we can do that at a later time. But today we really want to make sure that people have a pathway to have a master agreement, because we also do want to be ready when things do turn around. We'll have funding to be able to get out the door, and so we want to make sure that we're ready and willing and able to do it, hopefully when things look better.
Any other questions? I'll pause in a deep, awkward silence to let people ask their questions. Okay, we have a question in the chat. Is homelessness prevention a service that requires a master agreement?
For Housing for Health, our homelessness prevention program is something that is in-house. We have not contracted that out as yet. Will depend on the funding landscape if things change. But for now, we don't have a master agreement for that right now. I should say it's not a service under our master agreement as of now.
Go ahead, sir. Oh, you're on mute. Oh, can you not unmute yourself? Okay, hold on one second. Let me find you.
And so, Libby, can I piggyback on your response to that question? If people don't have a SHUSHMA right now, they can always request to get a SHUSHMA. And then if prevention services becomes a work order in the future, they would be well positioned to be ready to apply for that.
Yeah, but I actually want to say, so we do homelessness prevention through our work order agreements. So we have homelessness prevention assistance, financial assistance runs through the flexible housing subsidy pool. And the way that's operationalized through Housing for Health right now is through the homeless prevention unit that's staffed by staff at Housing for Health. But the financial assistance runs through the flexible housing subsidy pool. And then there's also homeless prevention assistance that runs through the flexible housing subsidy pool to support people who have been housed through subsidies and permanent supportive housing, as well as through some other county programs. For example, like BMH does some prevention support that's through the flexible housing subsidy pool. So just want to indicate that there is that. And then and I know Leapy, like we've looked at administering some other prevention funding through like local solutions funds. And that model is through ICMS to do the services and then flexible housing subsidy pool to do the financial assistance piece. So I just want to sort of share how something might be operationalized and how we have operationalized some of the prevention resources under SHUSHMA already.
Great, thank you. We do have a request, Ruth, if you don't mind putting the email where people can contact you in the chat, that would be great. And then we have a question from Carmen Pineda asking if you can explain in a little bit more detail what a work order is.
So a work order is the document that's attached to a master agreement that allows for you to provide services. So that is how the money is attached or the funding is attached to the master agreement. The master agreement just puts you in a pool of vendors. It adds you to the pool of vendors. So as services are needed, there's either a work order solicitation that's put out for services, or there's a direct award.
Carmen, is that helpful, or would you like, or do you need more explanation? Okay, just type in the chat, Carmen, if you feel like you need more explanation. We did have, let's see. We have a question from Sean Pleasance. Are we talking about full fidelity to the Housing for Health SHUSHMA, or will the new department have its own model?
I think that's why we're here today. So we do like the SHUSHMA and we've been using it effectively, and that's kind of why we're here. But if there are things that, you know, as we move into the new department that you feel we should change, or things that could be more effective, or if there have been pain points, we want to learn about it so that if there's an opportunity to do something else or do something more effective, more efficient, you know, we want to make sure that we're hearing you and figuring out what that could look like for the future in the new department.
Great. I have another question that came in that I'll put in the main chat, but this is the question. It says, on the solicitation site, are the new providers applying for HS 1041 to become a new provider?
If they're applying for, what was the number they gave?
1041?
Yes, that's the number.
Okay, great, thank you. Any other questions? Good questions. Okay. So if there are no more questions, we're gonna go into breakout rooms because we'd like to hear from you. And we have a few questions. So you'll be in a mixed group of folks with hopefully current contracted providers through that are currently have a or on the master agreement list and have a work order under the SHSMA. And then also for those of you that are not currently contracted, we have some questions for you as well. So the questions that we want to know are, if you're a current contractor, have you experienced any concerns or challenges with billing or payment? And just we can talk about those and have a discussion, and have those concerns or challenges been resolved? And then, do you have concerns with the SHSMA contract monitoring processes? Okay. For those of you that are not contracted yet, what are the challenges when accessing the SHSMA request for statement of qualifications? So that could be like technical challenges or barriers that you might be experiencing with the solicitation, the statement of qualifications application. And then, are there SHSMA terms and conditions you find to be challenging to comply with? If so, why? Okay, so those are the questions we're going to be talking about in our rooms. And now I'm going to give you, and you will have a facilitator and a note taker in each room. In just a moment, do we have anybody still in breakout rooms, team?
No, we closed the breakout room, so they all should have to return to the main room. And we are since recording.
Great. Welcome back, everyone. I hope that you had some fruitful conversations. I am hoping that a couple of our note takers would volunteer to just raise up some of the themes that you had discussion about in the rooms. Elisa, go ahead. Are you able to?
Yep. Oh, yep. I can unmute.
Great.
So in our group, Joshua was our facilitator and did a great job. We had probably about a third of folks who currently have a master agreement and everyone else did not. So thankful for those providers for just sharing their experience. And there were just overall, people enjoyed the master agreement. They found it easiest. They said DHS is the quickest funder that pays. So that is always a good thing. There was some conversation on billing around acuity level and how that shifts between low and high acuity. And then there were just some general comments around moving forward, will data be entered into CHAMPS or HMIS or both? So people, particularly with July 1 start date contracts, are really curious about where should they be placing their data. And will, moving forward, as this transition begins to happen, will there be different master agreements for each service component like rapid rehousing, interim housing, or one agreement with different work orders per provider? So good discussion. Thank you, group.
Great. Anna, I saw your hand raised as well.
Great, thank you. Yes, we had a combination of current contractors and those looking towards the process of being loss of contractors and moving over to SHSMA contracts. There was a recommendation that it would be really helpful to have a space to walk through that process step by step for those that are looking to become SHSMA contractors. Around budgeting and invoicing across multiple different orders, some coordination and streamlining around that. There was a groundswell of agreement that some streamlining there would be really beneficial. Also ensuring that on the contractor side, there's a loop in of program managers and also the legal and compliance folks to ensure that as contracts move forward and we move through auditing processes, that all people within an organization are in the loop on process steps. And then there was a recommendation around the timing of training. So to ensure that contractors are able to complete training to ensure that they're in compliance with their contracts. And then also ensuring that the components of the what components are sort of enforceable or monitored and which are not monitored in relation to the activities that are taking place within the contract.
Thank you, Anna. Connor?
Hi, everyone. I was in breakout room 5, and Jillian led the conversation with mostly Shishma contractors, echoing a lot of what Elisa and Anna have already said. But one thing to note was there was a request for CHAMP access for admin or financial views, and knowing that the process is to go through a case manager training, which is not applicable for admin and financial staff, but it would be helpful to reduce the burden to program staff to have more vantage points into CHAMP and have ability to do the invoicing with those viewpoints.
Great, thank you. And LaCheryl?
Thanks. Hi, everyone. I was here in breakout room 6 with Mia facilitating. We were in a group with everyone who currently has an agreement with DHS. So a couple things that came up around that is, how do you get a different work order for a different service if you already have one in place? So wanting to know the process, you want to provide different service. Also kind of looking at how this agreement works with other department contracts. So even though the provider may have an agreement in place but they don't have a current work order or contract, they're unable to get an additional contract with a different department. So kind of working how that works, figuring out how that works. Most people, there's been no problem with, if there was one, it was resolved quickly. So very good there. There's also just kind of an FYI, maybe in your advance, doing a frequently asked question for new contractors that they need to register with the county first, and that process can take a while, so that if new contractors understood that process as well would be helpful.
Thank you, LaCheryl. Danielle?
So we had 3 participants not Shishma contracted and 2 that currently did have a Shishma contract. We discussed issues with acuity levels changing and not being notified in advance, not enough guidance on assessment tools and how they process for acuity scores, and how that score correlates with a multi-factor analysis. Folks being assigned as low acuity, and then also having better clarity about when audits are taking place. There seems to be some misalignment with the agency-wide audit, and then it seems like it's very burdensome having to respond to audit findings because of not having the work order and the contract align. And with the lived experience, folks, they feel in the dark and they're looking for more opportunities to be involved. And someone raised having the experience of being high acuity longer than needed, because rental services are sometimes paired with a particular service.
Great, thank you. And I'll just add from my group a lot of what was echoed here about especially that switch from high acuity to low acuity, and just looking for guidance around being able to plan for any gaps in their budget and what they had projected. So we had some requests and some great responses from Housing for Health staff around, having conversations about guidance around that. And then the thing I'll add about contracting processes, about monitoring processes, is that it was raised that if one of the things, if you have multiple work orders and you have both CCMD and Housing for Health program staff coming out to monitor, that it would be great if those things could be consolidated or aligned in some way, so that providers don't feel like they're constantly under monitoring by the county. So if there was a way either to have CCMD and program staff to come out together, or just consolidating the monitoring of multiple work orders in one visit, would be helpful on the contractor side. And then we didn't have as many folks that were not current contractors, but they did ask what the common challenges people were having. So we spoke a little bit about some of the common challenges that we know about that could be barriers for folks that would like to get on the master agreement. Okay, does anyone want to add anything that you didn't hear reflected back?
I think I would just say in group 3, it was a lot of what was explained here, especially with the acuity changes, especially from family age to single adult. Some billing error issues, and sometimes invoicing delays when supplemental reports are being asked. And then for monitoring, it's just more of like having a great report for monitoring with no findings, but also being offered recommendations, but not getting those reports in a timely manner. So how do we tighten up getting that final report back out to folks when they have monitoring? And Maggie, let me know if I missed something else. It's going off my head and not my notes.
No, I think we covered a lot of the same.
Ryan, your hand is raised.
Yeah, thanks. And in group 6, similar themes. One I'll add that I haven't heard so far in the recap is contractors wanting to have different points of contact within Housing for Health, because Housing for Health is a very large structure. And so, yes, it's nice having a dedicated project manager, but there are different requests and different needs from different parts of that structure. And knowing who you can go to when there is a specific need or a specific question, and not always having to go through the project manager, was requested. They think that would improve communication and just transparency.
Great. Thank you. Thank you all for such great feedback. I'll give the opportunity of Leapy, Sarah, and Ruth, if you're still on the call, if you have any follow-up questions that you want to clarify as you're hearing this feedback.
She shook her head. She's on mute, but she said no.
There we go. I was trying to find my button. Sound good. This is all really great feedback, and I'm looking forward to sort of getting a condensed report so that we can really follow up with some of you. Hopefully there's agencies listed and some of the notes, so we can maybe do some targeted feedback and assistance, because it sounds like there are folks that are really struggling with some of the newer things that we've put in place with moving up and down in acuities, and we definitely want to get this right before we start to move over anywhere. But if you can even just reach out, put your email in the chat, so we can, and with your agency, so that we can do some research before we come back to you. We definitely want to make sure that we can start to resolve things even in real time, if that's possible.
Great. And I see Rick Stoff, you have your hand raised. Oh, let me see if I can unmute. I unmuted you. There you go. Sorry about that.
Is this the appropriate time to make a mention of what might be discussed at the next one of these?
Sure.
Okay, so I'm the vice chair of the West Side Coalition, 81 nonprofits, most of whom are not really directly involved with housing, but this is a two-way street. That's 81 partners with clients and resources and volunteers and things like that. So next time around, how can those people who are not directly, they're not going to contract with you about housing, but they could be helpful in so many ways, it would seem to me. And I say this without knowing too much about housing myself. My organization connects volunteers to nonprofits. But I think there's a two-way street here, and the more allies you have, the better. So think about that as a future theme, if you don't mind.
Absolutely, Rick. I think that's a great comment. Just to make you aware, we do have some additional engagements. We're going to talk about everything that's going on in just a moment, and places where you and the coalition members can plug in, regardless of whether or not they are housing providers, because we need to all be in on this, right? In solving this crisis. So we absolutely want to hear from you and engage with you. We will be presenting to the West Side Coalition about some of the upcoming opportunities as well. And LaCheryl, if you don't mind dropping those dates, and if we can pull the registration for West Side Coalition in the chat, that would be great. But we're just about to talk about all the overwhelming amount of opportunities for participation, Rick. So I appreciate your comment. Why don't we pull up the slides again? And Sarah, I'm going to turn it over to you. I'm going to ask you to unmute this time, though. I'm going to get ahead of it. Hold on. Where is Sarah? If someone could unmute. Oh, there we go. Okay, there we go. I asked you to unmute, Sarah. And Sarah, there we go.
Great. Thank you. And thanks everyone for the feedback that we just had. This was really, really helpful. So as Elena was mentioning, there's a lot of other opportunities for engagement, a lot of different things that are happening. So we wanted to sort of pull things together so everyone knows what's coming up next. The first is on the provider task force. So please keep your eye out for more information on the provider task force. In the board motion, excuse me, that the Board of Supervisors approved on April 1st. To form the new department, they called for the creation of a provider task force that will be comprised of at least 8 members who are currently service providers, wanting to have representation from all of the SPAs and subpopulations. And this group's expertise is going to really directly inform the creation of HSH as we continue to move forward. This is the group that will be bringing more sort of detailed conversations to around things like contracting and payments and that sort of stuff. So keep your eye out for the application process to be a member of this provider task force. The next one is the Measure A Labor Council. So hopefully this is not new to people who are on the call today. The purpose of the Labor Council is to bring together nonprofit and labor leaders to help guide conversations around pay equity and career development across Los Angeles County's contracted service providers. This is something that was built into the ordinance for Measure A. The applications to be on the Labor Council are due this Friday, August 22nd. You can scan this QR code right here to learn more and apply to be on this Labor Council. The next one is actually connects back to the earlier comment about what are we doing with all the funding cuts. So that really important conversation will be happening around the Measure A spending plan community engagement forums. So we're in the beginning stages of building out the Measure A spending plan that will be administered by HSH next fiscal year. The county is hosting community engagement forums to inform the spending plan. These are different than the community engagement work that our partners are doing at ChangeWell, because it's really about the budget for FY 26-27. And as you all know, we're preparing for funding reductions, for shifts, for a deficit scenario due to reductions at local, state, and federal levels. And so we're going to need to make some hard choices as a region around how to invest these Measure A resources. So we invite everyone to come to these sessions and to really help us answer the hard question about what can we cut. So you can learn more and sign up to attend a session by scanning the QR code on this slide. And then I am going to hand it over. Oh, I guess there's another one here that is on, oh, Changewell. Are you going to?
Yeah, I
present
can
this one?
speak to this one. Yes.
Thank you.
We'll be dropping so there's Rachel mentioned in the chat. There are lots of opportunities here, most of which are on the new department's website. So you can always go to the new department's website. The link is in the chat to find out about all the upcoming engagement opportunities, where you can plug in. We know there's a lot going on. We know that that everybody can't be everywhere, but we encourage that you sort of understand which events you should personally be at to give feedback and guidance, and also empower your team to participate in conversations to help shape sort of the next evolution of our system, right? So please, please, we want to hear from a variety of voices. So please encourage your teams to come to these conversations as well. Okay, so this last opportunity that we're going to talk about, oh, can you go back one slide for me, please? Is a conversation about the, I'll say, new governance structure, right? The relatively new governance structure around the regional homeless alignment and the Measure A goals that were adopted by the Board of Supervisors early this spring. There are, as we sort of talk with people around the county, people are still a little fuzzy on what these goals are, what got approved, like, what's ECRA, what's the leadership table, how are these things all related, where does the new department fit in? So this conversation, we have one tomorrow and then another one on August 28th. We're going to be going through that. We're going to go through the structure and how these different new governing bodies are related to one another and how it relates to the new department. And we're also going to talk about the Measure A goals that were approved. So if you're feeling a little fuzzy on that, please join us for that conversation, because this is really the anchor, right? A lot of the other conversations are tools of implementation that sort of come back to this foundation that was laid in the early spring around the Measure A goals. Okay, so please join us for that conversation. And we'll go to the next slide. Okay, so before you go, we would love to hear from you and what your priorities are, the things that you want to talk about in all of the upcoming engagements around the new department. It'll help us gather some information about you and where you're plugged in. Like Rick, I love that you're part of the West Side Coalition. We're trying to, map where everybody, like all the tables that people are sitting at, so we know where to be leveraging community feedback, like where are the places where we can maximize community feedback. So we'd love for you to participate in the survey. It's very short, and then we'd really appreciate it. And we'll put that link in the chat as well. Hopefully, I can't see the chat quite. Okay, and let's go to the next slide. We'll post these links in the chat. We'll send this all out as well post-event, along with the slide deck and the recording that will be posted. So final opportunity is the next town hall meeting. So these are happening monthly. As a reminder, this is another venue that people can participate in. We will be gathering feedback on topics that are sort of moving quickly on the background and in the development and structure of the new department. We'll be trying to stay ahead of that by putting things in front of the community to gather feedback from a wide variety of people. As things become, as we begin to focus in on things like structure, contracting processes, all of that. So the next town hall meeting is September 15th from 10 to 12. You can use this QR code, so many QR codes. You can use this QR code to register for that town hall. And there's also the link in the chat. Okay, and I will pause there. If anyone has any questions, please ask them now. And if not, then we will close the session for today. All right. Well, it was a pleasure. Oh, I see one in the main chat. Oh, thank you. Thank you.